Hello, guys. Welcome to another virtual biology lesson. And today's topic is health and disease. As I said, this chapter will be general, so today we're going to generally talk about what is health and what is disease. Guys, health is defined as the state of an organism where everything just works properly, where everything just works fine. Every organ is healthy, every organ is functioning properly. All the systems cooperate in order to sustain the internal equilibrium. They all want to, uh, they all work according to homeostasis. And guys, any abruption to this cooperation, any abruption, any failure is called the disease. We have a few types of health. First type of health is the physical health. So you're physically healthy, which means all your internal organs are working properly, all your internal systems are cooperating, everything just works fine. The second type of health is the mental health. So you feel good, you just feel good, you don't have mood swings, you don't have depression, you don't feel overwhelmed, you don't have any anxiety in you. This is the mental health. You are just functioning properly. And the third type of health is social health, that you are capable of forming healthy relationships with others, that you're capable of living in society. Those are the factors that impact our health, and there are three groups of them. First of all, and the one that we have the most to decide about is the lifestyle. Because we can choose our diet. We can choose to eat more vegetables than processed food. We can resign from a little bit of processed meat in favor of vegetables or other plant products. We can decide that we want to do physical activity. It's not there is nothing that just that just makes us not being able to do this. We can, to some extent, avoid distress by using all those techniques we have been talking about previously. And we can say no to stimulants. We can just decide not to drink alcohol, either too much or at all, whatever, but we can just limit the intake of stimulants. The second group of factors impacting our health is the environment, quality of water, soil, and air. Guys, most of the cases of any diseases in Africa, they come from contaminated water. If people don't have access to good quality water to drink and to keep up with body hygiene, then they will suffer from diseases. Soil. Soil is also important because whatever's in soil, then it will be in your food, on your plate. When Chernobyl reactor blew up in 1986, the radioactive cloud just covered three-fourths of Belarusian territory right now. And many of those areas are still radioactive. So when people are gathering mushrooms and berries and basically anything that they can find, they are consuming radioactive products. They are not neutral to your health. And air quality, this is something that we have started to discuss lately because it turns out that the general health of people that live in places where the air is good quality, they are just healthier. They are just healthier. And this has much impact on especially the respiratory system. Guys, another factor that is deciding on whether we are healthy or not, to some extent, of course, are the genes. Because in genes, you might inherit tendencies to fall in for certain diseases. If you have had many cases of cancer in your family, then you're in the group of increased risk. So, what you might want to do then is to stick to healthy lifestyle, because this healthy lifestyle will not protect you from diseases, but will dramatically lower the chances of you falling for many of them. Prevention. Guys, what you have to do in order to prevent yourself from falling for some diseases. First of all, routine medical checkups. When you go and check your state of health from time to time, then you are capable of finding out the moment when something is starting to break. So you might start the treatment earlier and you might make it less miserable than in most cases. This is especially important in terms of cancer. So women, breast cancer and cervical cancer, men, testicular cancer and prostate cancer. There are tests to find specific markers in your blood that they might tell there is something starting to happen. Start your treatment now. Physical activity, guys. Basically, if you're active, then you keep your body in a good shape. Blood vessels are capable for carrying enough blood. Lungs have a greater capacity. The pace of gas exchange just speeds up a little bit. Heart gets stronger and less prone to heart attacks, to any other cardiac diseases in the future. Bones get stronger as well. And guys, I hope that you remember that when we were talking about lymphatic system, that there is no such thing as the pump of lymph in your body. So when you move, you pump the lymph among your tissues. So this enhances the immunity of your organism. And muscles. If you move, then your muscles get stronger, they get a little bigger. I'm not talking about the case where some men just get injections of testosterone and other steroids to make them bigger and bigger and bigger, but I'm talking just about a healthy extent. And guys, the last one is the vaccinations, because we have eradicated a few diseases in the human history by developing and using vaccines. Don't believe in things that some people write in the internet, that vaccines are death, that vaccines cause autism, because there is no scientific proof that there is a link between autism and vaccination. What might happen that in some small percentage of people, there might be some side effects after the vaccination, but usually the side effects are less serious than the disease. So it's absolutely worth to be vaccinated. There are some cases when people can't get vaccinated due to their state of health, but then if people around them are vaccinated, then we have the herd immunity and we are protecting this one person who can't be vaccinated. And the disease is in the shortest abruption to homeostasis. So something is not functioning properly. This is the disease. And those are factors that make you more prone to falling for certain diseases. Unhealthy lifestyle, and here it's the diet, here it's no physical activity, here it's not avoiding stimulants and using and overusing stimulants, and also medicines. Sleep deficiency, because when you sleep, your body is fixing all the things that have gone wrong throughout the day. So if you don't get enough sleep, then your body doesn't have any time to fix it. And you know how it is. When you fix something that just broke, it will be done. But if you keep postponing and postponing it for later, then you get more and more things to fix, and it's not that easy anymore. Exposure to distress. Distress is a very dangerous thing for our health, both mental and physical and social. So if you're exposed to distress, not only it gives you a higher chance to fall in for a mental disease, but also for the just physical disease. Living in polluted environment, as I mentioned, in Africa, where they don't have enough access to clean water, to drinking water, to safe drinking water, they fall for diseases. We don't have such problem here in Warsaw, but there are some places in Poland where the access to clean drinking water is a problem. Contact with pathogens. Basically, whenever you're taking a bus or going to school or going to a shopping center, you have contact with pathogens and they can easily spread. The more people you meet daily, the bigger the chances are that you catch something. And as long as your immunity system is able to fight it, then it's okay. But you remember what was closed when the lockdown started: shopping centers, um, public transport, restaurants, all the places where people meet, because this is the perfect opportunity for any disease to spread. And guys, poor body hygiene. You could avoid many diseases if you just washed your hands. And not only hands, but it's also important to keep your surroundings clean. So, wearing clean clothes, wearing clean bed sheets, and so on and so on. This is absolutely important. Guys, infectious diseases, choroby zakaźne, those are the diseases that easily spread among the population. Because we have, for instance, genetic diseases. So somebody with, I don't know, color blindness, they cannot get anyone around them sick. But if you get a flu, then you're just infecting everyone around you. And guys, there are three main groups of such diseases: bacterial, caused by bacteria; viral, caused by viruses; and parasitical, caused by tiny animals, parasites. Here is the list of examples of disease, but there are many, many more of them. I just want you to know that there are three groups of them. And we have been talking about salmonellosis, syphilis, pneumonia, AIDS, COVID-19, common flu, sorry, toxoplasmosis, I hope so, malaria as well, and ascariasis as well. So you should already know these names. How do they transmit? And there are a few ways in which pathogens can transmit from one to another, from human to human, or from animal to human, or from human to animal, or from animal to animal, whatever. There are plenty of them. First group is airborne diseases, which are transmitted through tiny droplets of saliva that are exiting your mouth whenever you speak, breathe, sneeze, cough, whatever. This is why we had to wear masks in the public space, and we still have to wear them to protect others from the pathogens that are in our saliva. Foodborne diseases are the ones that you can get infected when you drink unclean water, when you eat undercooked meat or eggs, or especially chicken, where you when you eat dirty vegetables and fruits, so everything that comes to the fruit through the food, but also when you don't stick to rules of hygiene when preparing food, this might also happen. Sexually transmitted diseases are the ones that you can get infected during a sexual intercourse with somebody, and they are closely linked to blood-borne diseases and contact transmission. Because blood-borne diseases are the ones that you can get infected with after having a contact with sick person's blood. So after a blood transfusion or using the same syringe, or even at a hairdresser, it's possible if the hairdresser is not paying close attention to hygiene standards. And contact transmission, uh, those are diseases that are transmitted through touch. So if you touch a sick person's skin, you get infected. And those are fungal diseases that transmit this way, among others, of course. Anyway, you can also get infected through sharing personal items like hair combs, towels, clothes, and so on. There are also diseases of affluence, so-called diseases of affluence. So those are the diseases that touch the whole society, the whole population. And this is obesity. because more people in the world right now suffer from obesity than from hunger, which might seem weird, but this is the newest data. Atherosclerosis, which is linked to obesity, to poor dietary choices, miażdżyca po polsku. And this disease happens when the blood vessels are clogged with fat and blood can't pass through them anymore. Blood overpressure is also linked to this because when you have poor diet rich in sodium, rich in salt, then if you also don't have enough physical activity, the blood pressure can get too high, leading to many diseases, including the heart attack and strokes. Allergies, guys, if a baby is kept in a sterile environment as a baby, then its immune system doesn't have anything to fight against. The result is that it starts to fight against proteins that aren't dangerous, like pollen, like proteins from pet saliva, like proteins from nuts, and so on. This is also something that more and more people suffer, especially that it's been proven that if you live in an environment with poor air quality, you are more prone to allergies. Myopia. Long staring at the screen from not that far away leads to irreversible change to the shape of your eyeball. So you will have to wear those glasses probably for the rest of your life. And this is a real problem because younger and younger kids are given tablets and telephones and television, and they watch television from very close distances, and that leads to myopia outbreak. Spine defects are linked to the lifestyle, so they are linked to the fact that we are spending most of our days sitting down. And this is a huge problem because you have a variety of them, and some of them can be very, can bring many consequences. And neurosis, guys, if you live in distress, if you don't have enough rest, then neurosis might be one of those effects. And this is a disease that is touching more and more people. So if you're sick, you want to take a medicine. And here is a few information about medicines. First group of medicines are the OTC medicines, and those are the ones that you go to the pharmacists and you just get them without any prescription. RX medicines are the ones that you need doctor's prescription for, and those are mostly the OTC medicines are mostly the medicines like painkillers or some anti-allergy pills and so on. And those medicines, RX, are the stronger ones. So the strongest painkillers, the antibiotics, and many more. And there is also a third group of supplements, dietary supplements, that contain certain vitamins, micro and macronutrients, elements, and so on. The problem with them is that they are advertised in TV and radio like for most of the day. But according to the law, they don't have to be checked whether they actually work. And this is the problem because people believe that they will take a magic pill that will solve all of their problems that they have been gathering throughout past 10 years. And this is not true because most of them just don't work. Plus, when you overuse them, when you overdose them, when you mix many dietary supplements together, then it might bring more damage than good. Recent research states that mixing a few vitamins with each other, a few specific vitamins, that they shouldn't be mixed together because they bring more damage than good. So be careful with the dietary supplements. There are some things. Please always pay attention to whether it's a medicine, OTC or OTC or a supplement, because supplements are also to be bought without any prescription. And be careful with the supplements because, as I said, they don't always work and they are pretty expensive. And guys, the last thing I wanted to say today is antibiotics. Antibiotic is something that we as humanity uh, basically invented, maybe rather discovered. Let's leave it. But this helped to eradicate, this helped to fight many, many diseases. And guys, antibiotics are medicines that either kill or block the reproducing of bacteria, and only bacteria. Antibiotics don't work for viral diseases, and please remember this. When you have a flu, please don't take any antibiotics because this will not help. A flu is a viral disease. But what might happen if you keep taking them? Well, if you don't need to take an antibiotic and yet you take it, you might contribute to creating the superbacteria. Superbacteria is a concept of a bacteria that is resistant to every single known antibiotic. This might lead to very dramatic consequences. Because, guys, when a doctor prescribes you antibiotics, you must follow the instructions. So if he says, take it for 10 days twice a week, morning and evening, you must follow it. Because you have to make sure that you have a certain concentration of the active ingredient of the antibiotic in your blood. Because some of the bacteria will only die after being exposed to such antibiotic after a certain period of time. If that exposure is shorter because you've decided, well, I'm feeling okay, I don't have to take it anymore, then that bacteria might gain resistance to this. And then it will evolve, but the resistance to the certain antibiotic will remain. So this is the problem, guys. When you take the antibiotics when you don't need to, or you take the antibiotics shorter than it's needed, then it might lead to bacteria getting resistance to this. This is why it's so important. I heard that I read an article about Americans overusing antibiotics, and this leads to the first superbacteria that are absolutely resistant to every single known antibiotic. And this would be a real disaster if we had an epidemic of a bacteria that is resistant to every single weapon that we know. Okay, guys, so this is it for today. Thanks for watching. Please go to the assignments section, and there will be something waiting for you.